Have you ever wondered how the ancients viewed and treated breast cancer? The journey begins with a Greek physician. The ancient Greeks, led by the legendary physician Hippocrates, were among the first to delve into the mysteries of breast cancer. Hippocrates, often called the father of modern medicine, proposed that breast cancer was not merely a localized ailment but a systemic disease. He believed that an imbalance in the body's four humors, blood, black bile, yellow bile, and phlegm, was the root cause of this illness. While this theory might seem rudimentary by today's standards, it was a groundbreaking concept for its time. It set the stage for an evolving understanding of breast cancer, sparking centuries of theories, debates, and ultimately, advancements in treatment. This ancient understanding, as rudimentary as it was, laid the foundation for a journey of discovery that continues to this day. Fast forward to the 18th century, a time of surgical innovations and a bold proposal. A French surgeon named Henri Le Dran challenged the status quo, daring to propose a revolutionary idea. He suggested a surgical approach to treating breast cancer, proposing the removal of the tumor instead of leaving it to its fate. This was a time when the concept of surgery was still in its infancy, and the idea of cutting into the human body to remove a disease was met with both awe and skepticism. Yet Le Dran's audacity paid off. His proposal, although radical for its time, laid the groundwork for future surgical interventions in breast cancer treatment. Le Dran's method was not without its critics, and it faced numerous challenges along the way. However, it ultimately paved the way for modern surgical techniques that we now use in the fight against breast cancer. Le Dran's proposal marked a key milestone in the history of breast cancer treatment. The 19th century brought about a radical shift in the surgical approach to breast cancer. Enter William Halsted, a pioneer in the field of surgery, whose name became synonymous with a groundbreaking procedure known as the radical mastectomy. Introduced in 1882, this extensive operation involved the removal not just of the breast tumor, but also of the entire breast, underlying chest muscles, and nearby lymph nodes. The goal was to eliminate every trace of cancer in one fell swoop. For decades, this procedure was considered the gold standard in breast cancer treatment. It was a testament to the prevailing belief of the time. When it came to cancer, more removal meant better survival. However, it was a procedure that came with significant physical and emotional costs for the patients. Halsted's radical mastectomy, while a drastic measure, was the accepted norm of its time. As time marched on, the 20th century saw a move towards less invasive treatments. Enter Sir Geoffrey Keynes, a prominent figure in the medical world who suggested an alternative approach. He was a proponent of radiation therapy in conjunction with surgery to spare the breast, thereby ushering in an era of more conservative treatments. This was a significant shift from the previously dominant radical mastectomy procedures, and it was not without its detractors. Yet change was in the air. Another pivotal figure, Babette Rosamond, emerged to challenge the status quo. She boldly questioned the widespread use of radical mastectomies, advocating instead for alternative treatments. This sparked a wave of research and innovation, leading to a broader array of treatment options for those diagnosed with breast cancer. The 20th century was indeed a time of transformation. It marked a turning point, setting the stage for the era of modern breast cancer treatment. In our modern era, breakthroughs in genetic research have revolutionized our understanding of breast cancer. One such pivotal breakthrough was the discovery of the human epidermal growth factor receptor 2, or HER2 gene, back in 1984. This gene plays a critical role in the development of certain types of aggressive breast cancers. Fast forward a decade, and the mid-90s brought about the identification of two more crucial genes, BRCA1 and BRCA2. Mutations in these genes significantly increase the risk of developing breast cancer. These discoveries have revolutionized the landscape of breast cancer treatment. Now, instead of a one-size-fits-all approach, we have targeted therapies and personalized treatment plans. Treatments can be tailored based on a patient's specific genetic makeup, with therapies like trastuzumab, specifically designed to target HER2-positive cancers, and PARP inhibitors for those with BRCA mutations. These discoveries have not only deepened our understanding of breast cancer, but have also opened up new avenues for treatment. Today, the landscape of breast cancer treatment is vastly different from the past thanks to early detection and advanced treatments. Mammography, a type of low-dose X-ray, plays a pivotal role in early detection. By capturing images of the breast, it allows for the identification of tumors before they can be felt, providing a head start in the battle against this disease. On the treatment front, we've seen remarkable advancements. Trastuzumab, also known as Herceptin, targets cells that overproduce the HER2 protein, slowing or stopping the growth of these cancer cells. Anastrozole, marketed as Arimidex, is another game-changer. It lowers the production of estrogen in postmenopausal women, a hormone that can fuel the growth of breast cancer cells. These innovative treatments, coupled with early detection, have revolutionized the prognosis of breast cancer. They not only increase survival rates, but also improve the quality of life for patients during and after treatment. These advancements have significantly improved the prognosis for individuals with breast cancer. The journey of breast cancer research and treatment is a testament to human resilience and ingenuity. From the earliest understanding of the disease in ancient times, where Hippocrates suggested it was systemic, to Henri Le Dran's revolutionary proposal in the mid-18th century to surgically remove tumors, the radical mastectomy introduced by William Halsted in the late 19th century was a significant milestone, setting the standard for decades. Then came the paradigm shift in the 20th century with Sir Geoffrey Keynes recommending radiation therapy in addition to surgery, moving towards less invasive treatments. Babette Rosman's challenge to traditional radical mastectomies in the 1970s further sparked a shift towards alternative treatments and increased research efforts. In the modern era, the identification of key genes and the advent of targeted therapies like trastuzumab and anastrozole have significantly enhanced our understanding of breast cancer and improved outcomes for individuals diagnosed with this disease. From ancient beliefs to cutting-edge treatments, the story of breast cancer research and treatment is one of continual progress and hope for the future.